This short video is about how to add a patient and patient record within Nexus. So here we have incident year 1 Tauranga. We go into the patient section and we simply click on add patient. And we can add as many patients as we like. So we add a second patient, it changes patient 2, and we can just change between the patients. These modules down here are self-explanatory, and we can enter the data here, such as date of birth. If you want to edit it, it will automatically calculate the age. NHI currently is a manual entry. NHI search is coming. If you select non-New Zealand resident, it will ask you the extra fields with extra information required. If you select bariatric, a patient's bariatric, it will ask for some information around special handling, what was required in that. Medical history is a free text field, allergies, medications. There is a predefined list of medications. If the medication is there, it will pop up and you just add it. If there's a medication that the patient has that's not on the list, you can simply type it in, just press enter, and it will add it not to the list but to that patient record. Incident history is a free text field. Primary assessment, we have some drop down boxes for status seen, airway, and then you can add some notes around the airway, breathing, and so on. Secondary assessment, this page will change soon, but at the moment it's split into trauma patient with some primers. These are all free text fields. Medical patient, we will be adding a notes field and looking at some improvements to make this more, give you some flexibility. With vitals, you have a couple of ways of entering vitals. You can simply click on the square and enter it, or you can use the sliders, and it will automatically calculate your map for you. You have respiratory rate, SpO2, end-tidal CO2. You also have arterial blood pressures, and then GCS is defaulted to 15. You can just simply change that. Blood sugar, temperature, pain, capillary refill, pupils. ECG, you have the choice of 3, 4, 12 or pads. Rhythm, if the rhythm's not there or you want to add a note, you can just add a note. You simply save that, and you can go into the table and look at the recordings, and if you've made a mistake, you can simply go in and change it, and you will be able to edit the time as well. Let's just go and quickly add in another set of vitals. You save those, and then if you go into graphs, it will show you the trend of your top 5 vitals. So your blood pressure, respiratory rate, heart rate, oxygen saturation, and the more recordings you're in, the more that graph will change, and you can actually overlay it and see what the recording was at the time. Provisional diagnosis, if you select, say, a category of cardiovascular, it will cut down the primary clinical impressions to anything related to that. Interventions, you simply click on what it is you want, so OP, OPA, effective, clinician, date, and add. You can go and edit the reading after if you want. We have cardiovascular, access, hemorrhage, decompression, splinting, RSI, intubation, ventilator, and this also is like the vitals. You can just go set the readings, and so on. Other includes a few extras. Drugs, you start typing what it is you want, select from the list, dose, units, method, and route, and just add it, and you can edit it as well. If the drug is not there, you can just type it in, hit enter, and it will load it for this patient. So it won't add it to the list. If you select infusion, it will give you a infusion start, total in mils, and infusion finish. We will be adding a concentration field there as well. Transport, something like destination. Any field that's got a drop down list, you can shorten it by start typing, clinical pathway and destination, patient outcome, and so on. Notes, currently your current note fields, there will be a clinical consultant notes there. This is a snapshot in time of where we're up to. There is a lot of work going on in the background to add functionality, improve layout, and there will be continuous updates roll out, and you'll see those as they come through. But this is currently the where we are at the moment.